What's up, YouTube? I'm Mike, and today I'm back with another cycle treat for those of you in my audience who might be of the decidedly more health conscious persuasion. Obviously, you're all very well versed in the all of these cycles are relative. You know, when I run a gram and a half of gear, and I feel like that's a large cycle. You know, there's probably IFBB pros out there fucking, you know, who think this is TRT. So I tend to run about a gram and a half of gear when I'm on cycle. I shared with you guys a video not too long ago from another friend of mine that I met through my YouTube channel. We talked about, he's a 14-year long steroid veteran. He'd been blasting and cruising for 14 years. He happens to be in the medical community, and he runs substantially larger doses than what we're going to be talking about today, possibly even larger than I tend to run. So I showed you what happens when a person blasts large quantities of gear, even supposedly very hepatotoxic compounds like Superdrol. If you haven't seen that video, I will link it. You know, it'll be at the very end of this video. Today, I have another good friend that I've developed over the course of my YouTube channel career, who was also incredibly instrumental in helping me to psychologically navigate my recent health scare. I could not have made it without this gentleman in my life. So thank you, sir, very much. For everything that you've done for me and my family over the past few months. Could not appreciate it enough. This person is also in the medical community. He's actually an MD. So what we're going to be talking about today is the cycle that a fellow friend and medical doctor chooses to run from a much more health conscientious perspective than myself. He is running a cycle trying to cover all of the angles, stay as healthy as possible, presumably wants to run gear as long as possible. And so this is a decidedly more mild cycle. He has seen excellent gains across the gamut of effects, from effects on his bodybuilding, his day-to-day life, performance in the bed with his wife. Everything obviously has been improved by the use of this particular cycle. So I'm going to be going through everything. He's got very detailed information. So if you are a person who's not trying to become Jay Cutler tomorrow, you just want to be enhanced. You know, you want to get the best bang for your buck in life. You want to perform in the gym, you want to perform in the bedroom, but you want to stay relatively sane. You're not looking to blast large quantities of tren and other drugs that can be very psychoactive. This might be the cycle for you. Again, despite the fact that I'm getting this from an actual medical doctor, this is not medical advice. This is just what one other human being has chosen to do. It doesn't mean that it's the right way, the wrong way, the best way, the safest way. All I'm ever bringing you on this channel is just my experiences and the experiences of other people who are guinea pigging their bodies and choosing to share that data with me. So here we go. This gentleman is currently 56 years old. He was natty until the age of 53. So he's been running gear in various quantities off and on for the past 3 years and kind of worked his way up. I believe I'm accurate in saying that he started using tren after watching one of my videos or some of my videos. I'm pretty sure he's told me that in the past. I think that I'm the person that convinced him to shocking. Man, I swear to God, if they ever legalize tren, I'm going to be a millionaire because I'm going to sell this shit off the racks. Here we go. So the anabolics that he is currently using, for those of you who are looking for businesses, he's currently using ZPHC Ultra Blend. He is injecting 1.19 cc's per week. So at that dosage, or at that volume of oil, basically what that means is per week he is getting 120 milligrams of Test E, 108 milligrams of Mast E, 60 milligrams of tren E and 12 milligrams of trestolone E. So that is the total androgen load per week by using that blend at 1.19 cc's per week. If I remember correctly, I think he pens daily. So I think he takes that 1.19 cc's and breaks it up into a daily dose. I think that that's correct. He is, for his AI, he is using Aromasin at 12.5 milligrams on Monday, Wednesday, Friday. 12.5 milligrams of Aromasin on Monday, Wednesday, Friday. So right there out the gate, for those of you who think you don't need an AI, this gentleman is running 120 milligrams of test, which is going to aromatize, and he's got 12 milligrams of trestolone, which is going to aromatize. Those are the only two aromatizing compounds in his entire mix here. And that is, he's still taking 12.5 milligrams of Aromasin 3 times a week. So, for all of you who keep claiming that you take 300 milligrams of test and don't need an AI, or you know, these large doses of test and think you don't need an AI, interestingly to date, of every single one of my clients, I think this is accurate to say, every single one of my clients that didn't know their estrogen level, when I had them get their estrogen level tested, their estrogen level was high. 100% of my clients who have gone out and gotten E2 checks, maybe I'm missing a random that, I don't think so. I'm pretty sure 100% of my clients had high E2. I've even got a client whose testosterone level is not super physiological. His testosterone level is in the middle of the range, and he's a little bit overweight, not even like a lot, like 20 pounds, I think, and he has high E2. So he's a young guy too. So for all of those, I'm not going to keep beating people about their estrogen. If you're convinced you don't need an aromatase inhibitor, you think that the whatever dose of testosterone you're on is not giving you high E2, just put your money where your mouth is and go get tested. It doesn't cost that much. Go get a sensitive LCMS estradiol test, E2 sensitive LCMS test. Go get it tested and report back in the comments. I'd be willing to bet you your estrogen is high. So again, AI 12.5 milligrams Monday, Wednesday, Friday. For his lipids and metabolic modulators, he's using Rosuvastatin at 10 milligrams per day. I'm about to butcher this word. Ezetimibe. Fuck, dude. Ezetimibe. Ezetimibe. Fuck, dude. I don't know. Ezetimibe. 10 milligrams per day. Ubiquinol. 600 milligrams per day. Cardarine, also known as GW51526, which is, thank you for pointing this out. In the comment section, I had mentioned that this particular person uses SARMs, and he was quick to correct me that he does not actually use SARMs, that the things that I was calling SARMs are not in fact SARMs. So GW510526, also known as cardarine, is actually a PPAR, is that 6? That's some kind of weird character. PPAR, weird character, receptor agonist. He's taking that 10 milligrams per day injectable. He's also got in the mix stenabolic, also known as SR9009, which is a REV-ERB-A agonist. Don't know. 10 milligrams per day injectable. For anti-aging / healing purposes, we have in the mix 5 to 6 IUs per day of HGH. He specifies that he's using kitless forless generic. That's what it says, kitless forless generic. He's got TB500 at 1 milligram per day and BPC 157 at 375 micrograms per day. For mitochondrial health, something I've never even heard of, thought to look into treating. This is where the MDs come in handy. Mitochondrial health, he's using SS31, also known as enamipretide enamipretide. Dude. ENAMIPRETIDE. I may try to see if I can clip all of this and put it into the comment section, or excuse me, the whatever it's called, the description. I don't know if YouTube will let me get away with that. I may just give it a try and just copy and paste his whole write-up here into the description, because it is lengthy. So again, we're at mitochondrial health, SS31. He's using HMG. Please hit me up on Discord, sir, in the DMs on HMG, and let me know, do I need to add that to my HCG? I see a lot of people saying they don't know why somebody would run HCG and not HMG. I don't think I have any problems that HCG is not covering, but I'm open to be proven wrong. He's also got MOTS-C, capital MOTS-C. I know nothing about any of these compounds. I'm purely conveying what this gentleman is using. Rest assured, I will be looking them all up after going through this. For liver support, we've got NMN, trimethylglycine, trans-resveratrol. That's all on one line, so I'm assuming that's what that is. NAC, oh no, those I think those are three separate individual items there. NMN, trimethylglycine, trans-resveratrol. Then we've got NAC, silymarin, dihydroquercetin slash taxifolin. Man, I thought I was a fucking walking pharmacy. This is something else. We've also got NAD plus and glutathione, occasionally by injection. For blood pressure, I told you this thing was detailed. For blood pressure, we got Azilsartan, 80 milligrams, which is next generation telmisartan. Damn, I'm starting regretting making this video. I thought I had everything dialed in, and I'm reading one after another drug that I have no experience with. So he's using Azilsartan, which he's saying is next generation telmisartan. So I'm gonna have to get some info on that. We've got Nabivolol at 5 milligrams per day, Cialis at 10 milligrams per day, magnesium glycinate, 1,200 milligrams per day. Other antioxidants slash supplements. We got some supplements in the mix. Oh my God, I wish he would use one thing that I could read. Astaxanthin, I think is what we got here. Astaxanthin, 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 vitamin E, berberine and ALA with carb meals. He's using P6P to inhibit prolactin, which he's using in place of cabergoline on low-dose tren. I would like to know how much P6P you're having to use to control your prolactin, or as we're finding out, maybe not prolactin at all. I've got a video coming up going into the fact that I'm getting beaten. Like I feel like one of Mike Tyson's opponents. I'm just getting battered about in the comment section because I keep claiming that cabergoline treats trenbolone gyno, which it does. How it does it may or may not be, the jury may or may not be out, because finding actual elevated serum prolactin levels is seeming to be hard to come by. I know that I've had elevated progesterone levels when I had tren gyno, but he's using P6P in place of caber, so clearly it does something. We've got panthothene, PANTHOTHENE. We've got B complex with PQQ. We've got thyroid support complex pure. Both of those are from Pure. The B complex with PQQ is Pure, and thyroid support complex is Pure. Let me see what else of note. So that's the that's the current protocol. Holy shit, I thought my protocol was out of control. I would really like to know how much time he spends every day dosing all of this up, how he keeps all of this, how he keeps track of all of this. So what we see here is far less anabolics than I'm running. Far more support compounds. We've got lipid and metabolic modulators, anti-aging healing compounds, mitochondrial health, liver support, blood pressure. I hope to God that this is an extreme case of being extremely careful and that I don't actually need all of this, or I'm probably not going to be around very long. Let me see real quick. Let me read through our exchange. Let's see. He basically admits that he has some experience with SARMs, all injectables. There are good ones that are fucking strong. S23, RAD 140, LGD 3033. Also, YK11 has been deployed. He mentions that YK11 is really more like trenbolone. In fact, it is a 19-nor derivative. Makes me even more excited to try it. Let's see what else we've got here. He mentions that he does not feel that oral SARMs like Ostarine, AC262, or S4 are worth it at all. More side effects and less results than low-dose test plus VAR. So that might mean something to some of you. Again, I don't mess with SARMs at all. And I think that is it. He's got his most recent labs here. So I guess we could go over that. It's really nothing to go over. His labs are basically perfect. His hematocrit was slightly elevated, just barely out of the range. The range is 40 to 53. His hematocrit was 54.8. If I remember correctly, he said that he donates once a year. Interestingly enough, and to bring home the point that I keep trying to make about estrogen, if we go back to the top here, this gentleman is only running two compounds that can aromatize. We've got 120 milligrams of Test E and 12 milligrams of trestolone E with 108 milligrams of Masteron E in the mix, which is supposedly has SERM-like properties. So with a very low dose of aromatizable compounds, we've got 12.5 milligrams of Aromasin 3 times a week. And still, on his E2 test, his E2 came back high at 61 in a range of less than 44. So if it were me personally, I would knock that down immediately. I personally could not tolerate any amount of estrogen outside of the reference range. In fact, I may be out of the reference range right now. Because if you'll notice the size, when I'm talking about gyno and nipples, if you notice the size of my nipples right now, how they're very tiny. I know this is like, borderline gay, but if you notice how tiny the size of my nipples are, this is what I consider to be normal. This is what my nipples look like before I ever got onto any kind of anabolics. If my estrogen gets too high, my nipples will be slightly larger, but I will have soreness behind the nipple and itching. If my prolactin or progesterone or whatever happens when you use trenbolone, whatever the trenbolone pathway, whether it's an upregulation of the prolactin receptor, whatever the fuck is actually going on underneath the scenes, what happens to me in real life is that my nipples, rather than being tiny and small, get very large. It looks like a pregnant woman. Suspiciously. When women get pregnant, their nipples get much, much bigger, and then eventually they begin to produce breast milk. When I take 19 NOR compounds, nandrolone or trenbolone, and I'm going to continue to call it prolactin until it's proven otherwise. I don't give a shit what the blood work says. It's prolactin induced. My nipples get substantially larger and puffier. When I take cabergoline, independent of what blood work says, my enlarged puffy nipples go back to these tiny little sexy cute nipples. That's what I like to have. I don't want to have big puffy nipples that look like I've been breastfeeding a baby. That is definitively what happens on 19 NOR compounds. So right now this is an example of me having my prolactin or my cabergoline dose dialed in perfectly. the jury is out on my estrogen level, because what happens is when my prolactin is dialed in, my nipples are tiny and not puffy. When my estrogen starts to rise, the glandular tissue that is behind there always, it goes from being very mushy. It's like the glands are there, but they're soft and they feel rubbery to the touch. If my estrogen starts to rise, these glands or whatever the fuck is back there, my gyno, will start to get hard, and it'll get bigger. It'll swell up. So right now, I'm in a pretty good spot. Like, they're not totally gummy, but they're not hard either. So I'm guessing I may be off about a half. In fact, I think I'm supposed to take a 0.5 milligram of Adex today. So that would explain it. So here we have, still with a low amount of aromatizable compounds and Aromasin at 12.5 milligrams 3 times a week, we still have high estrogen on the blood work, which is why I keep telling you guys, your E2, all you guys, E2 is high. If you're not on a aromatase inhibitor, your fucking estrogen is high. Go test it and prove me wrong. In fact, you could be on an aromatase inhibitor and still have high E2. So, sex hormone binding globulin came back at 21 in a range of 13 to 90. So he's in the low end of normal, not crashed. Total testosterone 622. Now, admittedly, he's got other anabolic compounds in here. So he's got Masteron that's anabolic. He's got the trenbolone, very anabolic. He's got the trestolone, very anabolic. The trestolone will not raise your testosterone level. So when you see that 622, that's not indicative of the total amount of androgens that he has in his system. He seems to like being at this level. I do not. So for example, if I was on TRT only, my total testosterone will be somewhere in the 16 to 1800 range. Currently, where I'm sitting at 500 milligrams a week of testosterone, I'm in the 3,300 to 3,500 nanogram range. So the range here is 240 to 1,022. He's at 622, basically, well, kind of low end of normal, honestly. So I personally would want that much higher. For his own reasons, he's happy at this level. His free T, however, and this could be what he's targeting, his free T is 134.8 in a range of 30 to 135. So someone could make the argument that, hey, all I really care about is having free T at the top end of the reference range because that's what's doing the work anyway. And if I can run a low amount of aromatizable compounds like testosterone that also 5-alpha reduce into DHT, and when you start getting older in age, benign prostate hypertrophy or prostate cancer, prostate hypertrophy really starts to become something that you have to concern yourself with. He could be looking at this like, I'm at the very top of the range on free T at this dose, so why fuck with it? Again, my free T is fucking through the roof, which is probably why I'm growing body hair all over the place. Moving right along, we have glucose, urea nitrogen, creatinine. His creatinine is only 1.17. EGFR flags slightly high, but again, irrelevant. Bun to creatinine ratio is good at 19.7. Sodium, 1.38. His potassium was 0.1 out of range at 5.4 in a range of 3.6 to 5.3. And then everything else on the comprehensive metabolic panel is perfectly in range. Of note, however, his ALP, so this is liver enzymes. ALP is 64 in a range of 40 to 140. So that's fucking awesome. His alanine aminotrans, usually it's AST, ALT. I think that's the range. So if this is AST, it is. We've got 29 in a range of 5 to 60. And then ALT is 45 in a range of 12 to 47. So clearly, trenbolone at this dose, along with another 19 NOR compound in mint, is not hepatotoxic. All of his liver enzymes are perfectly in the reference range, and his bilirubin is ideal at 0.7 in a range of less than 1.3. Lipid profile. Even with now he does admit in his write-up that he has, I forget what he called it, basically genetic lipid issue. So he had lipid issues prior to running gear. Let me see if I see what he mentioned on the lipids. That doesn't really matter, but basically he was already dealing with lipid issues. We got too much back and forth to find it. It's irrelevant. His lipid profile, I've never seen a lipid profile that looks like this. So what he pulled, for those of you who are curious, is a cardio IQ NMR lipo profile with lipids. I have never seen a lipid profile look like this. Mine is just like total LDL, HDL triglycerides. That's all I get. What we've got here is LDLP, which his is high at 1093. The reference range is looking for less than 93.5, which gives his relative risk of moderate. It describes that LDLP is a relative risk. Optimally, you want to be less than 935. He's in the moderate range, which I guess is just a risk of developing atherosclerosis, I think, clogged arteries. His small LDLP is 503, which is high. They're looking for an ideal of less than 467, and his came back high, which puts him at the moderate risk level. His LDL size is optimal at greater than 20.5. He has a 20.7. HDLP is 34.7. Which is optimal, looking for greater than 32.8. So he's on the low end of optimal on both of those. Large HDLP is less than 3.0 liters. They want to be greater than 7.2 liters. So that flagged low and out of range. HDL size is 8.5 liters. Looking for greater than 9.0. So that flagged as a high risk element. Large VLDL-P less than 5. Everything else is optimal. So I don't. This video is running on long. I'm about to have to cut two together. So large VLDL-P, VLDL size, LDL cholesterol calculated is 40. Looking for a range of less than 100. His HDL is 47, looking for greater than 39. So the things that he's got flagging here are not part of what I've even ever seen on a lipid profile. I have no idea what the hell mine would be. So the numbers we're normally used to looking at is his LDL is 40, looking for less than 100. His HDL is 47, looking for greater than 39. His total cholesterol is 102. Holy shit. So his total cholesterol is phenomenal. I don't know what all this other stuff is, but his total cholesterol, mine is like 280. So he has a total cholesterol of 102, looking for less than 200. His non-HDL cholesterol is 55, looking for less than 130. Cholesterol to HDL ratio 2.2, looking for less than 50. And so all of the normal cholesterol things that we would look at are all optimal, which says to me that his cholesterol regime, what he's using to control his cholesterol is working in phenomenal fashion. His cardio IQ HS-CRP, C-reactive protein test. It's a high sensitive C-reactive protein test. His came back at 0.3. We're looking for less than 0.9. This is a marker of systemic inflammation. And because of this, that puts him at the very low level of risk. Understanding your inflammation levels is important to understanding your risk of heart attack or stroke. And his is optimal. His hematocrit, of course, we already mentioned that. And then last on the list, we have RD. These are just the things that have flagged high. They just sucked out all of the flags and put them together. So we've already covered that. So I'm about to have to cut this real quick. this camera gives me 30 minutes before it cuts me off anyway. It's so fucking annoying. And then when that happens, I can't just upload the single file. I now have to go into Blackmagic and cut them together and render it and put it up. So if you guys are wondering why my videos usually run 29 minutes, that's why. I would sit here and talk for an hour and a half, but it just means more work on my end. So there we have it. So this is the blood work and protocol of a 56-year-old medical doctor who is looking to get, the maximum number of positive gains from being enhanced. He wants to see better gym performance. He wants to see less body fat, more muscular, more vascularity, more muscles, more vascularity, better sexual performance, better energy levels, less clouding, less cloudy brain fog. All of the things that we know come from having low testosterone or not being enhanced. And so he has managed to find a protocol that works for him, that keeps basically every one of his, the normal things we look at. Like I said, that lipid profile is beyond me, unfortunately, but everything in his blood work that we care about, again, this is up to each person. That estrogen level I would personally knock down. It's 61. It's 20 points outside the top end of the reference range. I would personally knock that down. But if he's not having any problems, doesn't mind carrying slightly more body water than he would if at a lower level, then obviously that's perfectly, it's up to each user to decide. So like I said, I don't want to beat this point to death. I just wanted to give you guys sort of an alternative to what you're used to seeing on my channel. So if there are people in my audience that are looking for, and again, please do not take me out of context here. This is not medical advice. I am not saying that this is a doctor endorsed protocol. I am saying that this is what a 56-year-old, very health conscious doctor has conscientiously decided to do. This is what he clearly feels is the best bang for his buck. He's not trying to be, he's not trying to be a competitive bodybuilder, so he's not blasting large quantities of gear, trying to get the maximum amount of gains that you can possibly get. He's found something that makes him happy in life and keeps him feeling comfortable that he is not unnecessarily stressing his body and driving himself into an early grave, as I almost certainly am, despite the fact that, at face value right now, all of my biomarkers look good. One of the things that this gentleman actually informed me of when I was going through the shit with my liver is I said, hey, now that my liver enzymes are returning to normal, when they get back to normal, should I go get another sonogram to look to see if there's any lasting liver injury? And he was like, well, you could, but the thing is that sonogram is not really going to show you that. And I don't remember the name of the test that he recommended, but he said, if you really wanted to see how injured your liver is, you could go get this test done. It's very expensive, given the short duration of inflammation that damage that your liver took, probably not worth it. So I don't want to mislead anyone when I say that based on the clinical tests that I've had done, that I have a perfectly clear bill of health. I can't honestly know that. I short of having probably thousands and thousands of dollars of tests or full body scans and multiple, looking at things from multiple different angles, I have basically covered my bases to the best of my ability. I can't know. Like, for example, my dad just had a stent put in his jugular. Was it jugular? Carotid artery. He had an 80% blockage in his right side carotid artery. Left side carotid artery. So his left side he had an 80% blockage, and his right side had a 50% blockage, and they went in just a few days ago and opened up that left side carotid artery. So is it possible that I have a blockage in my carotid artery and I don't know? Sure. I've never had that scanned. When I check my blood pressure in my right arm is usually 10, sometimes 20 points higher in my left arm. I've read that means that I have a clot somewhere. It's not my aorta. It's not anywhere in my chest cavity. But you know, it's possible that I could drop dead tomorrow of a stroke from a clot that's over here in my shoulder, maybe somewhere, God knows where, that I didn't know. I mean, I can't rule out every single possible thing. So when I say that I have a relatively, or I say I have a perfectly clean bill of health, from what can be seen on a sonogram, a CT scan, every piece of known blood work, known, you know, like they looked at everything when I was in the ER. And back in December when I thought I had lymphoma, I pulled every cancer blood work panel you can fucking pull. Everything came back in normal reference range. So as far as I'm concerned, to the best of my knowledge, I am perfectly healthy. Clearly, I do not have this gentleman's lipid profile. And so it is entirely possible that I am on a fast track to athereo. Somebody help me out. Athereo, arteriosclerosis, are these two totally different things? Huh? Is there even an arterio? Am I making that up? Arterio. What's the difference?
One is a kind of the other.
One is a kind of the other.
Like there's atherosclerosis, I think arteriosclerosis is a specific type of that maybe?
So there's atherosclerosis. Athero. See, my wife is the shit. Notice how she's not in there correcting me. She learned her lesson. She's like, fuck it. I'd rather him look like a moron. I think I mispronounced whatever that Augmentin I was on. I kept calling it Augmentin Clavinate, and that was not right. Like I actually looked at the fucking bottle, not in the midst of a rage, and I mispronounce words all the time. So Athero. Atherosclerosis is what I could possibly be developing from having stratospheric levels of cholesterol. I'll worry about that down the road. So now I'm just completely rambling on in this video. There you have it. I think I've said that for the 4th or 5th time now. This is a cycle that you could consider. I'm not advising anyone to take any particular drugs or break any laws or do anything, but this is what this particular gentleman is doing, and he has a very clean bill of health doing it. So if you are just looking to kind of enhance your life a little bit and you're not trying to get, you know, completely out of control and get on a bodybuilding stage or be a freak like I'm trying to become, then this just might be for you. Yes, there you have it. So as always, comments, this is not my cycle. So be respectful, please, in the comments, because this is somebody else who has been willing to put forth their particular protocol. So if you have something negative to say, I'm going to request that you be kind in your, be constructive in your criticisms if there are any. And again, don't jump in the comments and be like, whoa, this is not very much gear. Again, this is a person who's using for different purposes than some of us in this community. I think it's likely that there are probably more people watching my content that are going to appreciate this cycle than they even do mine, because most people seem to not want to blast gear the way I do. So hopefully that this will be well received. But again, because I am someone else was kind enough to give me their data, I'm not going to tolerate any fucking bullshit in the comments on this. So as always, thank you for watching. We'll see you on the next one.